Hello, my name is Sarah Fleming, CEO of Serenity Health and Wellness Corporation. What you are about to see is not a proposal for a new program. This is a clear explanation of a system that already exists, already operates, and is already producing results, and what it will take to formalize, align, and scale it at the regional and state level. We are going to walk through what the problem actually is, what we have built, how it aligns with federal direction, how it saves money, how it generates revenue, and exactly what is needed to move it forward. Public health achieves measurable population-level impact, and Serenity operates a sustainable coordination hub aligned to outcomes. This is a system where savings and revenue are aligned. Emergency room visits, hospitalizations, and incarceration. A single behavioral health emergency visit costs between $1,500 and $3,000. Incarceration costs over $38,000 per person per year. And nationally, avoidable behavioral health emergency visits exceed $8 billion annually. At the same time, 85% of counties in Ohio are designated behavioral health workforce shortage areas. So the reality is this: we are spending billions responding to crises while failing to prevent them. The core issue is simple. No system owns pre-crisis stabilization. When someone is discharged from a hospital, released from jail, or identified as high risk, there is no single system responsible for keeping them stable. Instead, individuals cycle between hospitals, courts, and community services, and back into crisis. Serenity Health and Wellness Corporation operates the system. We manage intake, we coordinate navigation, we stabilize individuals, we build workforce, and we track outcomes. This creates a single point of accountability. Serenity operates as the coordination hub that aligns these funding streams. This creates a sustainable system where revenue is directly tied to outcomes. Here is how it works. All referrals come into a centralized intake point. Those referrals can come from hospitals, courts, schools, and community programs. Once an individual enters the system, we do not wait for crisis. We assess risk immediately. We assign a navigator. We stabilize that individual through care coordination, behavioral health connection, housing support, transportation, and workforce pathways. Then we monitor and support them until they are stable. This is not just case management. This is coordinated, accountable, system-level infrastructure. At the federal level, CMS has introduced the Aspire model. Aspire is designed to move Medicaid away from fragmented reactive care and toward coordinated prevention-focused systems. It requires early identification, wraparound coordination, long-term stabilization, and cross-system alignment. That is exactly what this model does. But here is the critical distinction. Aspire is a funding and policy framework. It does not build local systems. It requires them. Serenity has already built the operational infrastructure that models like Aspire depend on to succeed. This is not duplication, this is execution. At the same time, this model solves the workforce crisis. We do this by building a pipeline. We engage high-risk youth and young adults. We train them. We place them in structured internships. We transition them into behavioral health careers. This creates a system where individuals who are stabilized can become part of the workforce that stabilizes others. We are not just reducing crisis, we are building long-term system capacity. This model works because it reduces the most expensive parts of the system: emergency room visits, hospitalizations, and incarceration. Evidence-based navigation models show returns of up to $4 for every $1 invested, with typical returns between $2 and $2.50. Our internal predictive model projects a 45 to 55% reduction in crisis escalation based on comparable systems. Even small reductions in repeat crisis events generate significant savings. The system is already spending the money. This model redirects it more effectively. This is not a grant-dependent model. It is a revenue-generating system. Revenue comes from multiple aligned sources: Medicaid billing for services already being delivered, managed care contracts tied to cost reduction, hospital community benefit investment, opioid settlement funding, and workforce development funding. Serenity operates as the coordination hub that aligns these funding streams. This creates a sustainable system where revenue is directly tied to outcomes. Each part of the system has a clear role. Public health serves as the convener, bringing systems together and aligning strategy. Healthcare systems invest in prevention to reduce emergency utilization. Medicaid and managed care organizations benefit from reduced high-cost claims. Counties align funding across public health, justice, and recovery systems. Serenity Health and Wellness Corporation operates the system. We manage intake, we coordinate navigation, we stabilize individuals, we build workforce, and we track outcomes. This creates a single point of accountability. To move this forward, we are asking for 4 specific actions. First, alignment. Recognition of this model as coordination infrastructure across public health, healthcare, and Medicaid. Second, a Medicaid pathway, a clear strategy to position prevention and navigation through Medicaid pilots, managed care value-based contracts, or bundled service models. Third, pilot development, support to structure a regional pilot with a defined population, centralized intake through Serenity, and measurable outcomes tied to cost reduction. Fourth, access, connection to decision makers across Medicaid, managed care, healthcare systems, and county leadership. This is not about building something new. This is about formalizing and scaling what already exists. To sustain and scale this work, we are seeking up to $1 million in aligned investment. This is not startup funding, it is bridge funding to stabilize operations and position the model for long-term system integration. This model works because everyone benefits. Medicaid reduces high-cost claims, hospitals reduce emergency utilization, counties reduce incarceration and crisis strain. Public health achieves measurable population-level impact, and Serenity operates a sustainable coordination hub aligned to outcomes. This is a system where savings and revenue are aligned. Serenity Health and Wellness Corporation is already doing this work. This is not a theory. This is not a pilot concept. This is an operational system. The opportunity now is to align it with policy, funding, and system leadership. The question is not whether this works. The question is, how do we position it correctly and move it forward together?